as I said, I'm Wendy. I work up at Kyneton in the Masson Ranges at Central Highlands Health, and my project's lead is to help navigate oncology services within our region. So the main sort of, I guess, problem that this project's trying to support is that people with cancer in our region are not routinely referred to coordinated services close to home. Often coordinated multidisciplinary survivorship care is challenging because basically geographically where we're centred, the primary treatment for our clients is Bendigo, Melbourne, Ballarat, but our community live in an area that doesn't have a primary treatment area. There's no general tumour or cancer care coordinator roles within our hospital currently, and there's often a lot of confusion and lack of staff awareness of what services are available and what clients are eligible to access within our services. So the objectives of this project is really to start to develop a database similar to the domains of survivorship that you've seen previously within our community, so that we can build connections with our stakeholders, with our clinicians, with our clients, with our referral pathways, so that we can start to offer services that we know that are there to link people into. We're also looking to formalise the Allied Health Navigator role within our service and pilot using an Allied Health Navigator to link clients into support services using this database. And we're also going to start to map a bit more of a community demand for survivorship supports and services within our region. We expect in the short term that we're going to increase our engagement with our consumers, and we're already starting to have a lot of dialogue with our partnership services. We've got multiple community health services, allied health services, public and private we're looking at, not just in terms of the public sector. We've formalised the Allied Health Navigator role, and we've started to create this database. So we're looking at how do we deliver a bit more of a community-based cancer survivorship care. In the medium term, so we are providing information and knowledge to our allied health professionals within our area. We're hoping to improve the satisfaction and confidence for our clinicians to refer. They know the eligibility, they know the criteria, they know what services they can confidently refer our clients to. The consumers are going to have increased screening in terms of their needs and supports required, and referrals that are going to support them to the care that they need. We're hoping that the consumer experience and satisfaction improves. We know there's a lot of confusion, or we wish we knew about this. We wish we knew about this sooner. Why haven't we heard about this service? So we're hoping that their knowledge and their satisfaction improves, and that we start to be able to map out a bit more of what that demand is for local support. We're finding that people are often travelling an hour or so, either Bendigo, Ballarat or Melbourne for their primary treatment, but locally they want to know what's available. And over a long time, we're looking at how do we improve that quality of life for our consumers, our survivors, and also their carers, taking that demand off that they're often having to support in terms of travel as well. So to date, we've had a forum that we had 16 participants come and give their input in terms of their experiences, their challenges, their barriers, and what we can do better. We've had some advisory committees with our executive, with our consumer reps, and with clinicians within the region. We've started to survey the local allied health professionals in terms of what is their understanding about survivorship, how are they screening people, what services are they able to provide, how do we actually link them into that, and what are their education needs, what do they need to know more to support the people that they work with. We've started to create the database that will then become shared across our Loddon Mallee region, our mixed services, and hopefully wider to that. And we've started to have a lot more dialogue within our primary health networks, community health services and community providers. We're in a unique area that we are crossed over by 2 primary health networks. We've got 2 different ICS services within our region. We have multiple community health services that are stretched across their cohort. So that actually to be integrated is quite a challenge, is trying to develop those pathways and I guess the confidence between our services, how we work together. We can't do it all in isolation. We actually have to work together to support our community. And we're hoping that in the next few months we'll screen our consumers and then start to use our database to increase the referrals.